Radiotherapy can be an extremely daunting process for any adult coming through for treatment, never mind children. This year we've had around 10 children come through the department for radiotherapy. So that's why we established the Radiotherapy Pediatric Working Group. It was established about 8 years ago with 2 members, and over the years we have developed in size and experience with 13 members now working in the group. Its main aim is to tailor our care to the needs of each individual child and patients' families coming through for treatment. So we meet about once a month to discuss new ideas, new projects, and constantly develop what we have in place for our children. One of our most recent projects is the painting of these thermoplastic masks.
So as you can see, the moulds are quite cold, clinical and scary looking for anyone of any age to be clipped to a bed with, but this can be a bit more difficult for children and young adults. So when they arrive up for planning, if it's decided that they need a mould, they're sent to the mould room where a mask is fitted specifically to them. At this point, we would meet with the child and their family to discuss with them what they'd like on their mould. We'd show them a few examples of what we've done previously and then ask them who their favourite character is or superhero, and then once it's decided what they would like, we then research who it is, because it might be someone we've never heard of before. And then we would draw on an outline of what we're going to paint. After that, we'd then start painting the mould. The whole process would take anywhere between 1 and 3 hours, depending on how difficult the mould is. And obviously the paint has been tested to ensure that it's safe for the children and also that it doesn't interfere with the treatment. So when the patient comes up for treatment, obviously their mould looks a lot different to what they've seen previously. It's now something fun as opposed to something that might be a bit more scary. So hopefully this makes treatment a lot easier in that while they're getting their treatment they can be their favourite character or superhero.
Not all children will get these masks made. It's only for children who have cancers of the brain, head and neck area, just to keep them as immobilised as possible so the treatment is delivered as accurately as possible. It's so satisfying to see the transformation from that clinical sterile mask into an amazing character that the children really want, and the joy in their face is just something that we work towards, and that's why we've made the group possible.
We just have to say a big thank you to Friends of the Cancer Centre because they've kindly donated the funds for the paints necessary to get this initiative off the ground, and it not only makes the patient's experience a lot better but it also gives me a bit of a fun thing to do in work as well.